Priority questions. Question number 1 in the name of Deputy Billy Kelleher. When you're ready, Minister.
Thank you, Count Corley. Early in 2012, the HSE put together a list of high priority locations for the development of primary care centres across Ireland. It is the intention of the Government to develop as many centres as possible by one of 3 separate methods: direct investment, by way of leasing arrangements, or by way of public-private partnership. The locations were then considered for development by way of public-private partnership, or PPP, as part of the Government's stimulus package. Selecting the primary care centres under PPP wasn't, as is generally believed, done on the basis of one criterion, the deprivation index. 3 criteria were deployed: the deprivation index for the catchment population of the centre, the service priority identified by each integrated service area and local health office, and accommodation assessment, which assessed accommodation available for the primary care team within the catchment area and the quality of the accommodation, and whether or not the accommodation was spread over one or more buildings. The HSE in this new process identified 338 locations for primary care centres. From this, 20 were selected on the basis of accommodation availability in the locale, service priorities and deprivation. 37 locations within the list of 338 had similar rankings. I accepted the first list of 20 prospective centres presented by the Minister Shortall, but I decided, in consultation with my department officials and government ministers, to go beyond the initial mathematical model, that the number was too small and that we needed at least 35. Advice from the HSE and the Department of Health, based on experience of PPPs, is that if only 20 were pursued, considerable slippage could arise and the health system could lose a badly needed investment. I also took into account that the track record of the HSE in delivering PCs on time is poor. In addition, the 115 million stimulus fund available could only be accessed by means of PPP. As I wrote to Minister Shortall on the 25th of July, and I quote, "A very strong consensus emerged at government level that identifying 35 locations would stimulate and encourage wider interest and participation." In other words, if we were to identify only 20 and stick with 20, GPs would then be able to sit back, await their completion, and then enter on their terms only. If you look at what happened in an urban area where a primary care centre has been built, the process began 4 years ago with pre-contract discussions with local GPs. The building was completed in 2012, but it still took several more months to get the GPs to move in. And a similar situation arose in a rural area. So the list was widened. In addition, new criteria were added. It was evident, for example, that consideration needed to be given to existing health facilities, GP to population ratio, pressures on services, particularly acute services, funding options, including exchequer-funded HSE, build or lease, and implementability of a PPP relating to size, site and scale. In relation to existing health facilities, for instance, that criterion was added because if they weren't considered, you could possibly have a health centre or primary care centre built in the shadow of an acute hospital, while a nearby area of great need would be left without a primary care centre. This would make little sense. Under these criteria, 15 additions were made to the list. Some of those extra 15 had in fact been identified by the HSE as far back as 2007 as high priority under a Fianna Fáil government. However, because of the weighting I mentioned earlier, multiplying the deprivation index by 3, 2 of these areas, which had been identified in 2007, Balbriggan and Swords, both lost out. They got swept from high priority to low priority. Under the original priority system, both would have been in the top 35. However, under the new system, with an altered weighting system, they ended down the list. The realities hadn't changed, but the weighting made it look as if the realities had changed. And here are the realities. Balbigan is an area of high unemployment with no existing primary care centre, where the current health centre is in very poor condition. Balbigan will in fact proceed under a lease arrangement. Swords has a population of 48,000 people, no primary care centre, no direct public transport link to its hospital, Beaumont. There can be no doubt that these two areas are high priority for primary care centres. It is my intention to further primary care developments as resources become available.
Thank you, Thanks, Minister, for the reply. So, first and foremost, Minister, may I say that 2 weeks ago, Minister Shorthold, at the time, came into this Dáil and she made a statement. And there's two things of interest in that statement. One was the omission of any support in the confidence motion in you. She didn't mention the Minister for Health by name or by office in any of that 4-minute contribution. And the other key issue that was of interest in that statement, the then Minister said, the public have a right to expect the decisions on health infrastructure and staffing will be made in the public interest based on health need and not driven by other concerns. Now, quite clearly, Minister, there are other concerns at stake here, because there was originally 20 primary care centres selected by the deprivation index, and then you said that others should be added to ensure that that GPs may not or could not hold the process to ransom. And I can understand that. But I mean, clearly the most obvious scenario would have been to go to the next 15 in the list. If you were to comply with the high priority 20 that were selected by the deprivation index, and then to change the criteria halfway through to allow others in. Now, Minister, being quite clear, the public-private partnerships confer commercial advantage on people. The state enters into a contract with individuals or an entity, and it confers commercial advantage on those people.
Could frame a question, please.
And would the Minister not agree that by doing that, that you have to have a transparent and open manner, and that it should be free from any form of interference or even alleged interference? Now, I wonder why a minister at the time would come into this Dáil and stand up and say that she had concerns and that the public had a right to ensure that it was done in an open, transparent manner without any other concerns.
Thank you.
Now, and would the minister agree that, at the end of the day, 4 that were identified, 2 in your own constituency, 1 in Kilkenny and 1 in Balladreen. And I'm just wondering, Minister, what type of criteria was used? Did you run it by your cabinet colleagues? Because some of your cabinet colleagues said quite clearly you didn't. Minister Radcar on television recently said that it could be perceived to look like stroke politics. He was unaware that there was consultation. Was there an aide memoir sent to government? Was there a memo sent to government? How did you consult with your colleagues, or was it just done in the corridors somewhere, some night? Because this certainly needs to be clarified once and for all.
Call the Minister.
Thank you. I absolutely agree that primary care centres should be chosen on a needs basis. And the widening of the criteria helped meet those needs in a much more complete manner. And the manner and the criteria are transparent, and I've outlined them here to you today. I've also indicated that as far back as 2007, when your government was in power, which is purely coincidental, the HSE identified the 2 towns of Balbigan and Swords as being high priority and in need of a centre. Now, that's over 5 years ago, and since that time the populations of both those towns has increased, unemployment has increased, and the needs of the people could not be described as having been diminished. They are in fact greater than they were. So I stand over, as I said, the manner in which this was done. I stand over the criteria which are used, and I will be happy to explain whatever aspect of this you fail to understand.
Thank you, Deputy Minister. Thank you. Deputy Kelleher.
Well, Minister, it's not that I only failed to understand. I mean, the former Minister with special responsibility for primary care failed to understand as well. And some of your cabinet colleagues failed to understand. So it isn't just Billy Kelleher who is the only one in this House who can't understand the criteria that you decided to use to select certain primary care sites outside of the matrix that was used previously in the deprivation index. Now, all I'm saying is quite clearly that if we are talking about a high priority and using a matrix called a deprivation index for 20 of them, and all of a sudden the whole criteria changes, to other issues like population, location of other health centres, and other associated criteria. That quite clearly, that undermines the process from start to finish. Because if the first 20 are based on one index and the others are based on the Minister Reilly index, well, quite clearly, you certainly have not prioritised the key ones as outlined in the original index. And it's not that I'm trying to find anything untoward. It's just that this does, and is quite evident, does not have a transparent, open process in awarding a commercial advantage to individuals by the state. And that clearly is something that is of major concern to many people, including the former Minister, Róisín Shortall, who resigned because of it. Minister. So would you agree that this issue does not sit well with many people other than myself here in the House?
Final reply from the Minister.
Well, I have no wish to enter into an argy-bargy with the Deputy across, and I know that's not the tenor of his comments, but I do have to point out that I did say in my opening answer that the deprivation index was but one of 3 criteria used in this process. There was also the service priority identified by each integrated service area local health office, and there was also an accommodation assessment. So there was 3 that had been used. But what happened was then that the deprivation index was given a weighting of 3, so it was multiplied by 3. And that resulted in considerable change in the prioritisation. And I have to put it to you that by broadening the criteria to take into account the issues that I've just mentioned to you in relation to health facilities available in the area or lack of, accessibility to health facilities, as in public transport accessibility, and the population to GP ratios, I mean, you get a much wider, I think, fairer balance. If we were to use the deprivation index only, I think this would have a very, very strange effect. And in fairness to Minister, or now Deputy Shortall, she didn't. She used 2 other criteria. I used additional criteria, and which I think are fair also. And I would point out to you, Deputy, that in her resignation, this issue was not mentioned per se. So I want to put on the record here, actually, if I can, Alas Ceann Comhairle, my gratitude to Minister Shortall for the hard work and the commitment that she had towards primary care, one that I share myself, and for a lot of the work that she did. And I want to welcome the nomination of Deputy Alex White to the department, and I know that he will continue the work that she has done, and in particular I would hope that the great work she did in relation to alcohol and that scourge of a problem that we have in this country in relation to it, that her work will be carried on, in particular by Minister White. But he will be, I have no doubt, committed to the full range of commitments that Deputy Shortall